If you've ever felt burning, stabbing, electric, or shooting pain that doesn't behave like a pulled muscle or arthritis, chances are you are dealing with nerve pain. And here is the truth. Nerve pain is different. Different causes, different symptoms, different treatment strategies. In this video, I'm going to break nerve pain down clearly. What causes it, how it feels, why it behaves the way it does, and why so many people struggle to get relief. If your pain burns, shoots, shocks, tingles, or doesn't behave like typical pain, listen to your body. This isn't weakness. This isn't exaggeration. This is your nervous system asking for the right kind of care. Watch till the end to learn 5 things you must do to regulate your nervous system to control nerve pain. If you've tried medications, therapy, injections, and even surgery, and you're still in pain, this video is for you. It's not because nothing is wrong. It's because the strategy has been incomplete. Pain does not equal damage. Nerve pain plays by different rules. Stay with me because by the end of this video, you'll understand why nerve pain lingers and what actually helps calm it. Now, let's get down to it. What is neuropathic pain or nerve pain? This is when nerves generate pain signals. Nerve pain, also called neuropathic pain, happens when nerves are damaged, irritated, inflamed, or malfunctioning. Unlike muscle or joint pain, nerves don't just transmit pain, they generate it. That's why nerve pain feels unpredictable, can persist long after an injury heals, often doesn't show up clearly on X-rays or MRIs. Broadly speaking, nerve pain comes from peripheral nerves, which are located outside the brain and spinal cord, and the central nervous system, which means the brain or spinal cord is the source. This distinction matters because treatment differs. Now let's talk causes. Because nerve pain doesn't come out of nowhere. 1. Direct nerve injury or damage from the following: trauma, surgery, nerve compression, stretch injuries. Once a nerve is damaged, it can misfire, sending pain signals without cause. 2. Infections. This is one of the most overlooked causes. The chickenpox virus doesn't leave your body. It can reactivate later as shingles. When pain persists after the rash heals, it becomes post-herpetic neuralgia. This pain can last months or years. 3. Diabetes. High blood sugar damages small nerve fibers over time. This leads to burning, tingling, numbness, loss of protective sensation. These symptoms often start in the feet. 4. HIV and other systemic diseases. Chronic inflammation and direct nerve toxicity from treatment medications play a role in these cases. 5. Radicular pain or sciatica. This comes from spinal nerve root irritation, often due to herniated discs and degenerative spine disease. The disc may compress the nerve root, or it may release chemicals that cause inflammation. These chemicals irritate the nerve roots, causing pain that radiates down the arm or leg. This is called sciatica or lumbar radiculopathy when it occurs in the low back and leg, and cervical radiculopathy when it occurs in the neck and arm. How nerve pain feels. Nerve pain has a signature. Patients often describe burning, stabbing, electric shock sensations, shooting pain, throbbing, pins and needles. Patients can also develop loss of sensation in the affected area, reduced reflexes, muscle weakness. Some nerve pain conditions deserve special mention. CRPS, Complex Regional Pain Syndrome. This is a complex diagnosis that includes severe disproportionate pain, skin color and temperature changes, swelling and stiffness in the affected limb. Some people experience pain from things that shouldn't hurt, like clothing or light touch or even a slight breeze. This is called allodynia. This often follows injury or surgery. This isn't imagined, it's dysfunctional nerve signaling. Neuropathic or nerve pain often involves the process called sensitization. Sensitization is when the nervous system turns the volume up. There are 2 key processes. 1. Peripheral sensitization. 2. Central sensitization. Peripheral sensitization means the nerves at the injury site become overreactive. Central sensitization means the brain and spinal cord amplify pain signals. At this stage, the nervous system itself becomes the problem, which is why nerve pain becomes chronic. Here is the hard truth. Nerve pain becomes chronic because damaged nerves regenerate poorly. Abnormal pain pathways get reinforced. The nervous system learns pain. Without early targeted treatment, the pain system can rewire itself, leading to peripheral and central sensitization. This is why treating damage alone often fails. Delayed treatment worsens outcomes. One-size-fits-all pain medications fail. Proper diagnosis is everything. Some key takeaways as we wrap this up. Nerve pain has distinct causes, produces unique symptoms, requires specific treatments. What makes nerve pain different? Nerve pain is not muscle pain. It's not joint pain, and it doesn't behave like inflammation from strain or arthritis. Nerve pain happens when nerves are irritated, injured, inflamed, or misfiring. And once nerves become sensitized, they can generate pain even when tissues look normal. That's why scans are often normal, yet the pain is very real. Stay with me and watch to the end to find out 5 things you must stop doing to overcome this debilitating condition. Now let's talk about what actually helps nerve pain. Treating nerve pain means calming the nervous system, not chasing damage. Education. We know fear amplifies pain, and not understanding why you're in so much pain feeds fear. This is why the first step is to understand why this pain is so persistent and not going away, even when the wound is healed. This is the whole point of this video. Understanding pain reduces fear. When pain makes sense, the nervous system relaxes. Nervous system regulation. When nerve pain becomes chronic, the nervous system shifts into a constant threat state. The volume knob is turned up and it stays there. At that point, the goal is not to push through. The goal is to teach the nervous system that it is safe again. That happens through regulation using the techniques described here. 1. Breathing techniques. How your breathing calms your body. The way you breathe sends messages to your brain. Fast, shallow breathing tells your brain something is wrong. Stay alert. Slow, steady breathing tells your brain you are safe. This isn't just about relaxing. It's how your nervous system actually works. Simple breathing habits that help. Breathing slowly through your nose, making your exhale longer than your inhale. Letting your belly rise and fall, not just your chest. These actions switch on your body's calming system and quiet overactive nerves. In short, your breathing tells your body whether it's safe or in danger. Breathing equals safety signal. Preventing the boom-bust cycle. One of the biggest mistakes in nerve pain is overdoing it on good days. You feel better, you push hard. The nervous system flares. Pain spikes for days. That's a sensitized nervous system reacting to overload. Doing less than your maximum. Stopping before pain escalates. Keeping activity levels predictable. This consistency builds trust in the nervous system. Avoid the boom-bust cycle. Number 3. Sleep restoration. Regular sound sleep is the nervous system's reset button. Figure out a way to get regular sound sleep. Poor sleep keeps nerves inflamed and hyperreactive. During deep sleep, pain processing is recalibrated. Inflammatory signaling decreases. Nerve thresholds normalize. When sleep is fragmented, pain sensitivity increases, sometimes dramatically. Improving sleep often reduces pain before any medication change. Sleep calms nerves. Number 4. Consistency in treatment. not intense treatment. Why intensity backfires? In nerve pain, intensity is often interpreted as a threat. Short bursts of aggressive or intense treatment can worsen symptoms, even if the intent is good. Consistency sends a different message. Regular movement, predictable routines, gentle repetition. This teaches the nervous system, I can handle this, I am safe. Progress doesn't come from pushing harder. It comes from repeating safe signals over time. Consistency beats intensity. Regulation is not passive. It is an active retraining of the nervous system. And once the nervous system calms, everything else works better. Key truth: medications, physical therapy, movement, healing. That's why regulation isn't optional in nerve pain recovery. It's foundational. 5. Graded movement. You need to keep moving, but it should be gentle, predictable movements. This retrains nerves that movement is safe. Progress is slow but real. Regulate before you escalate. Movement equals safety signal. Sleep heals nerves. What recovery really looks like. Here is the truth no one wants to hear. Nerve pain doesn't disappear overnight. It fades gradually. You start to notice fewer flares, shorter pain episodes, better sleep, less fear, more good days than bad. Recovery is not zero pain, it's regained control. Progress is gradual. Control is the goal, not elimination. What you should stop doing. 1. Stop chasing miracle cures. 2. Stop assuming pain equals damage. 3. Stop pushing through severe flares. 4. Stop blaming yourself. 5. And stop letting anyone dismiss your experience. This is a complete mindset shift that will help you cope and overcome feelings of disappointment and frustration. Nerve pain is real and it deserves informed care. Stop chasing cures. Pain does not equal harm. Flares need respect. If you're living with nerve pain, hear this clearly. Your pain makes sense. Your nervous system is trying to protect you. It's just overdoing it. On this channel, I'll teach you how to quiet it step by step. If this video helped you understand your pain even a little better, like the video, subscribe and share it with someone who needs to hear this.